I chose nursing because my mom is a nurse. I knew I was going to deliver babies every day. That's what I knew I was going to do. Once I trained into the NICU, the critical care babies, you know, I loved it. All right, big guy, you are getting so big. I wanted to take care of the sickest of the sick babies. You know, I wanted that challenge. I love the critical thinking part. I love trying to figure out what's wrong, how do we fix it, how do we get them to, you know, be healthy.
Trish also helps lead Sutter Health's support of March of Dimes, an organization dedicated to improving the health of babies, especially preventing prematurity.
It's very important to, you know, help raise money for this organization. You see these tiny little 1-pound babies, maybe you can get them next year to 2 pounds or 3 pounds, and they might still have a NICU stay, but, you know, maybe we'll be able to help them further along.
Trish and her husband know firsthand the value of this research funding. A routine ultrasound early in her second pregnancy revealed a big surprise.
So you can see 3 right off the bat, 3 little heartbeats, and I'm like, oh, this is cool, triplets. And then all of a sudden they move down a little bit and there's a 4th. And no one really says anything at first, so I'm just thinking, okay, I don't know what I'm talking about, so maybe that's nothing.
It was something, all right. Baby number 4.
Quadruplets are fairly rare. With the increase in assisted reproductive technology, we do see more and more of them. And we're becoming more comfortable with the management of these, what we call higher order multiple gestations. On average, a quadruplet will deliver sometime between 28 and 30 weeks.
Dr. Gilbert is the high-risk OB the Cruises turned to when they found out they were expecting quads. He's worked closely with the March of Dimes, developing key protocols to prevent preterm delivery.
Dr. Gilbert he was an answer to our prayers. Yes, I carried these babies, you know, 32 and 4 weeks, and they did great, but he was a big part of that.
There's Mommy. Ready? Yeah. Procession to the OR. All the essential people.
Number 1. I remember as soon as I heard Reagan's cry for the first time, all that emotion coming out. As Patrick came next and Liam, then Aubrey, it was just as soon as Reagan came out, I knew everything was going to be okay.
Every dollar we raise promotes better outcomes, ongoing research, even legislation aimed at treating and potentially preventing prematurity.
I now have lived the life of a NICU mom and had 4 preemie babies, and I benefited from the research from the March of Dimes. The March of Dimes is an incredible organization, incredible.
Sutter Health and the March of Dimes are once again partnering to raise money to help moms have full-term pregnancies and research the problems that threaten the health of babies. All it takes is one look at Reagan, Patrick, Aubrey, and Liam, and you know, this partnership helps.
We're very blessed. The kids are healthy. Addie's a wonderful big sister.
We live a life that not many other people get to live. It's an amazing life.